Dr. Sherman, you're undertaking a study of 20,000 Emirati citizens. That's a hefty percentage of Emirati citizens.
It's 10% of adults.
So the government must be concerned about some societal or cultural shifts over the last couple of decades in the Emirati population. Can you describe what they're seeing?
Absolutely. So one of the reasons that makes it fascinating to be here doing a study like that. In the U.S., we know a lot about trends in cardiovascular disease and diabetes because we've been following these things for 40, 50 years. And the U.S. has had some cultural shifts, but nothing as abrupt and as quick has been the shift here, where it's gone from being primarily small tribes and so prior to the advent of oil and this shifting from a low-income country to now a high-income country, that's had tremendous shifts in every aspect of society. That if you look at the diet, that's changed. You can look around at all the different amazing restaurants that you see here in the city with people eating at them all the time. I heard somebody the other day at a talk saying that it's terrible because they go to the park and they see the expatriate children out playing in the park and many Emirati children eating at Kentucky Fried Chicken, which would be more like New York City, where or in the U.S., where fast food industry is exactly that, a huge industry. So that's anecdotal, but what we do know for sure is that the prevalence of diabetes here and the prevalence of obesity and overweight is among the highest in the world. The rate of cardiovascular disease is high, even though this is a young population. And one of the reasons we're doing our cohort study is to try and help the government and the research community to understand why. I think we suspect that it's not just diet, it's not just a lack of exercise, but other factors as well. So we'll be looking at genetics, we'll be looking at cultural issues to try and figure out why some of these diseases are so prevalent here.
You talked about some alternative forms of tobacco that are popular here, and one was Dokha, D-O-K-H-A.
Mm-hmm.
Could you describe how that differs from cigarettes in terms of nicotine intake?
I wish I could. So at this point, we're still working with people to try and get analyses done on the exact chemical content of it to see how much nicotine do you get from one Dokha pipe, from smoking one pipe of Dokha versus smoking one cigarette. There's only been a half dozen published studies on this, unlike the few 100,000 studies published on cigarettes, so we really don't know much. What I do know is that people smoke this, what seems to be the equivalent to me of one cigarette, and they smoke it in one or two puffs in this pipe. The pipe is a midwach pipe. And the name Dokha itself comes from the Arabic word meaning dizzy, because of the feeling people get from this rapid inhalation of what's probably nicotine and other chemicals.
And what about water pipes? You described the difference between cigarettes and the nicotine rush from water pipes.
Anecdotally, when we've done focus groups, people tell us that some say that when they first started doing it, they would get dizzy from smoking water pipe. Others would tell us that they don't mind, that they don't feel anything bad which they attribute to the flavors. And I think the flavors have made water pipe a lot more popular. Some people would point out that that's why it became so popular in the 1990s, was the advent of flavored shisha or flavored tobacco.
But you talked about the duration of a session with a water pipe versus smoking one cigarette.
So it is very different in that you smoke a cigarette and that might take 5 minutes, maybe a bit longer or a bit shorter. People who go out with their friends, and it usually is, if they're going out, it usually is with friends, would smoke for 60 or 90 minutes. And if you look at the literature, that can be, there's differing estimates, but anywhere from 3 to 10 up to 100 cigarettes from that one session. So the exact number doesn't really matter as much to me as a physician. The fact that somebody is getting a half a pack or a pack or 2 packs of cigarettes from one session is scary to me, because I know how bad cigarettes are for people.
Most of your practice and your research has been in New York City. Can you describe what you saw in New York City over the years as taxes increased?
Mm-hmm. I've been fortunate as a smoking cessation or tobacco control researcher to have spent 14 years in California, which was a tremendous place from a tobacco control perspective, and then the last 10 years in New York City, which is an equally tremendous place. California led the nation with taxes on tobacco and with starting a state quit line to help people quit smoking, and the California Smokers Helpline, with whom I've worked a bunch, has been one of the most published and one of the most successful quit lines in the country. New York City has now been a fantastic place to be thanks to Mayor Bloomberg, where the price of cigarettes increased dramatically up to about $12.50 for a pack of cigarettes now. The clean indoor air laws that were passed prohibiting smoking indoors essentially anywhere, and even in parks and on beaches. And mostly it's just gotten to be very difficult to smoke in New York City, and that has helped to change the culture so that it's no longer easy to be a smoker in New York City, which is great from my perspective.
Thank you.
You're welcome.